Did you know that every 6 minutes a senior suffers a stroke that could have been prevented? It's a chilling statistic. But behind that number is a grandmother who will never tell stories again, a father who can't walk through his garden, a life extinguished in an instant, the most terrible part. And the reason I am speaking to you today with an urgency I have rarely felt is that new research reveals many of these tragedies are linked to 4 commonly used medications. Medications you likely... Of the medications we'll discuss today act like a virus that overloads the system, short-circuiting the wires of that invaluable computer. And the worst part is, they do it silently, until it's too late. With that image in mind, let's begin to unravel the mystery. Ibuprofen, open that medicine cabinet and shine a powerful light on the dangers lurking inside. The quick fix for a headache, back pain, or that morning arthritis is perhaps the most common. We buy them over the counter, taking them almost like steroidal anti-inflammatory drugs, safe, or NSAIDs. And that is the danger, their false appearance of innocence. For a young person with a strong heart, an occasional ibuprofen isn't a major issue. But for someone over 60, especially if they take it daily for osteoarthritis or arthritis, the story changes completely. They cease to be an ally and become a saboteur. How can something so common be so dangerous? It's not one single thing. It's a perfect storm of 3 mechanisms acting at once. The first is an increase in blood pressure. Think of your arteries as a garden hose. Blood pressure is the force of the blood flowing through it. NSAIDs cause your body to retain sodium and water, increasing the volume of blood. At the same time, they can make the arteries more rigid. The result? More liquid forced through a narrower, stiffer hose. The pressure skyrockets, and hypertension is the #1 risk factor for a stroke. It's like stressing the pipes in your house day after day. Sooner or later, one will burst. The second mechanism is more subtle. It affects your kidneys and your platelets. Your kidneys are the body's master filters. NSAIDs can damage these filters, especially in kidneys that are already decades old. A poorly functioning kidney worsens hypertension. Furthermore, they alter platelets, the cells that form clots to stop bleeding. By disrupting their balance, they can ironically cause clots to form where they shouldn't, like in the arteries of the brain. The third is the final blow: atherosclerosis. Chronic use of NSAIDs promotes constant inflammation in the lining of the arteries. This inflammation is like sandpaper rubbing the inside, creating rough areas where cholesterol sticks and forms plaques. A piece of that plaque can break off and travel to the brain, causing disaster. Think of Carlos, 68, a retiree who loved his garden. He suffered from osteoarthritis in his knees. His solution? Diclofenac, 2 pills a day, every day. It's the only thing that takes away the pain, he'd say. His blood pressure was a little high, but he didn't think much of it. He didn't know that every pill was adding fuel to the fire. His pressure was rising silently, his arteries hardening. One morning, while watering his roses, he felt dizzy and dropped the hose. He couldn't lift his arm. He was having a stroke. The cause was a clot, but the soil had been fertilized for years with each harmless pill. So what do? Live in pain? Of course not. The key is strategy. First, and I will always repeat this, never stop any medication on your own without talking to your doctor. That is just as or even more dangerous. The solution is an honest conversation. Ask your doctor directly, "Doctor, with my age and my blood pressure, is this NSAID the safest option for me? What is the minimum, effective dose I truly need, and for how long?" And you must explore alternatives. Acetaminophen is often a much safer first choice for the heart. There are topical gels and creams of diclofenac or ibuprofen that act only where it hurts, reducing systemic risk. And don't underestimate the power of physical therapy, exercise, heat, and cold. The goal is not to patch the pain, but to treat the root of the problem in the safest way possible. Knowing this gives you the power to ask the right questions, and those questions can protect your brain. Now let's move on to the second group of medications. Almost no one talks about this one in relation to strokes, and that's what makes it so dangerous. It targets a very common problem that people are often embarrassed to talk about: overactive bladder or incontinence. For millions, the fear of an accident limits their life. The solution is often a pill, an anticholinergic medication. Names like oxybutynin, tolterodine, or sulfafonacin are common. They promise to restore control, and they work. But what few will explain is their direct connection to your brain health. To understand this, let's talk about acetylcholine. It's a primary messenger in your nervous system. It's vital for muscles, including the bladder muscle, but it is also absolutely crucial for memory, learning, and cognitive function. It's the oil that lubricates the gears of thought. Anticholinergic drugs block this messenger. In the bladder, this relaxes the muscle. Problem solved, right? No. Because these drugs aren't guided missiles. They are cluster bombs. They enter your bloodstream and travel throughout your body, reaching the brain. And there, they block acetylcholine too. The first effect, the most well-known, is cognitive decline. Their continued use is associated with a higher risk of dementia. Patients complain of confusion, brain fog, poor memory, and drowsiness. They blame it on age, never suspecting it's the bladder pill that is dimming the lights in their brain. But the danger goes further. The connection to stroke is sinister. Acetylcholine also helps regulate blood flow to the brain. By blocking it, these drugs can prevent cerebral arteries from dilating when they need more oxygen. This can create areas of low blood flow, setting the stage for a stroke. Furthermore, side effects like dizziness upon standing or sedation can destabilize an already fragile cardiovascular system. It's like asking your brain's air traffic controller to work with half the staff and failing radios. A disaster is only a matter of time. This is the story of Martha, 75, a widow and very active. She started having an overactive bladder. The fear of an accident was confining her to her home. Her doctor prescribed oxybutynin. At first it was a miracle, but over the months, her daughters noticed she was more forgetful. One day, getting up from the sofa, she felt a terrible vertigo and collapsed. She had suffered a TIA, a transient ischemic attack, a warning that a major stroke was on its way. When doctors reviewed her medication, the connection was obvious. The drug that gave her back her social life was threatening her life itself. If you take a medication for incontinence, you must act. Again, don't stop it suddenly. First, check if your medication is an anticholinergic. If it is, call your doctor. The key question is, Doctor, I'm concerned about the effects of this drug on my brain. Are there more modern, safer alternatives? The good news is, yes, there are. There's a newer class, the beta-3 agonists like mirabegron. They work through a different pathway that doesn't interfere with acetylcholine, and their risk profile is much better. Also, never forget non-drug therapies. Kegel exercises for the pelvic floor work wonders. Bladder retraining with fixed schedules is also very effective. Incontinence deserves a solution, but not one that jeopardizes your brain. The third group we must discuss is often seen as a lifesaver. I'm talking about systemic corticosteroids like prednisone or dexamethasone. If you've had a severe allergic reaction, an asthma attack, or live with an autoimmune disease, they're almost magical power. They calm rampant inflammation in hours and give you your life back. Because they are so effective, it's hard to see them as an enemy. But this power comes at a price, especially with long-term use. Using oral corticosteroids chronically is like making a deal with the devil. They give you immediate relief, but the bill your body has to pay is enormous. And one of the most severe charges is a skyrocketed risk of stroke. The problem is that corticosteroids don't just attack one front. They launch a multi-pronged offensive that weakens your defenses. I call it the corticosteroid triple threat. Threat number 1, hypertension. They cause your body to retain sodium and lose potassium. This leads to fluid retention, increasing the volume of blood your heart has to pump. It's the same mechanism as NSAIDs, but often much stronger. Threat number 2, hyperglycemia. They raise your blood sugar. They interfere with insulin and can even cause steroid-induced diabetes. Suddenly, your body has the same problem as a diabetic. High sugar is toxic to the inner lining of your blood vessels. It's like bathing your arteries in syrup day after day, making them rigid, brittle, and prone to inflammation. Threat number 3, a lethal combination. They alter your cholesterol, raising the bad LDL, and can make your blood thicker, more prone to clotting. The stage for disaster is set. Arteries damaged by high pressure and high sugar, with denser blood ready to form a plug. What do you do with a drug that is often indispensable? The answer is don't take it. It's use it with extreme intelligence and caution. The conversation with your doctor about this must be one of the most serious you have. The goal is always the lowest possible dose for the shortest possible time. You must ask, Doctor, have we exhausted every alternative to reduce my dependence on corticosteroids? If their use is unavoidable, the plan must be to mitigate the damage. That means much stricter control of blood pressure, glucose, and cholesterol. It means a diet very low in salt and sugar, and regular exercise. And now we arrive at the fourth and final drug. I've left it for last because it carries the greatest risk and is used in one of the most dangerous ways in the care of our elders. I'm talking about antipsychotics. Drugs like risperidone, olanzapine, or quetiapine were created for severe psychiatric disorders like schizophrenia. In that context, they save lives. However, an alarming practice has become widespread. Their off-label use to treat behavioral symptoms in dementia. Think of someone with advanced Alzheimer's. They may have aggression and anxiety behaviors that are distressing for them and incredibly difficult for caregivers. In an overburdened healthcare system, the quick and easy solution is to prescribe an antipsychotic to calm the patient. But this solution is a chemical game of Russian roulette. The world's most important regulatory agencies, like the FDA, have issued their most serious warning, the black box warning, on their use in elderly patients with dementia. The reason? They nearly double the risk of death, primarily from stroke. The specific risk of suffering a stroke can even triple. Their mechanism of harm is devastating. First, they cause orthostatic hypotension, a brutal drop in blood pressure upon standing up. This causes dizziness and falls. But that drop in pressure also means that for a moment, the brain isn't getting enough blood. Repeating this day after day can trigger a stroke. Second, they can cause havoc with the heart's rhythm, generating arrhythmias that form clots that travel directly to the brain. Third, they induce a brutal metabolic syndrome, weight gain, high blood sugar, and high cholesterol. This is the most difficult but most important conversation a caregiver can have. If your loved one with dementia has been prescribed an antipsychotic, you must be their advocate. Ask the doctor firmly, Doctor, I am aware of the black box warning. Have we exhausted absolutely all non-pharmacological options? What is the plan to taper off this drug as soon as possible? Because the truth is, there are alternatives. The first line of treatment for agitation in dementia should never be a drug. It should be investigating why they are agitated. Often it's an unmet need. Are they in pain they can't express? Do they have an infection? Are they scared or bored? Behavioral interventions are key. A calm environment, music they love, simplifying tasks, validating their feelings. They require time and patience far more than writing a prescription, but they are infinitely safer and more humane. Using an antipsychotic in an elderly person with dementia should be the absolute last desperate resort for a very limited time, and only when everything else has failed. The price is, too often, a devastating and preventable stroke. We've been on a tough journey, I know. We've opened the medicine cabinet and pointed a finger at 4 culprits hiding in plain sight. The NSAIDs, the Anticholinergics, the Corticosteroids, and the dangerously misused antipsychotics. My message today is not for you to be afraid. It is for you to take control. We have delegated our health to a system that, sometimes out of haste, chooses the easy pill. But you are not a passive patient. You are the conductor of your health orchestra. The knowledge you now have is your most powerful tool. The ability to ask the right questions, to have a dialogue with your doctor, not a monologue. Don't leave here with anxiety. Leave here with a plan. Review your medications. Identify if any of these are on your list, and schedule an appointment with your doctor, not with fear, but with the confidence of someone who is taking the reins. I ask you one last thing. If this video has been helpful, don't keep it to yourself. Share it. Send it to your sibling who cares for your mother. Share it in your group of friends. Every time you share, you could be preventing an emergency call, a hospital bed, a broken life. And please, use the comments. Tell me your experience. Reading your stories enriches us all and builds a community of support that is vital. Thank you for your time and your attention. Take care of your brain. It's the only one you have. Until next time.